Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Very pleased that you are here with us this fine evening. I know the sunshine is kind of hard to get out of the sunshine, but y'all are here for a really important purpose for your health. So, if you haven't already, sign up for your Marlene's newsletter where you get to know about all the monthly sales, articles, recipes, and of course, wonderful classes. Tonight's presenters, we have Dr. Audrey Falcone. She is a board certified family physician and a co-founder of Physicians Coach. And Dr. Falcone is also specializes in emergency ultrasound medicine. So we're going to learn about that tonight too. And then we have Dr. Ayla Hopkins. She is a naturopathic doctor and also co-founder of Physicians Coach. And she is the head of the functional medicine at Physicians Coach. So y'all are here to learn about a functional medicine approach to healing injury. So let's give these lovely ladies a round of applause.
Thanks for being here and everybody on Zoom. We're super excited to be here. I've been involved with Marlene's for many years. I grew up coming here. It was one of my first exposures to kind of a healthier lifestyle. So they're very near and dear to me, and I'm excited to be chatting with y'all today. So like Elizabeth said, we will be talking about a functional medicine approach to healing from injury. I will be speaking on a portion of more of the functional medicine approach, and then Dr. Falcone will be speaking a little bit more on the sports medicine and how we integrate the two. See next. Sure. The clicker's working. I was excited about this thing. Is that from there? Yeah. Okay. Okay. So who we are. Brief introduction. I am Dr. Ayla Hopkins, co-founder of Physician Coach. I am a naturopathic physician. I grew up in Gig Harbor, Washington, and then ended up growing up there. Absolutely loved it. Went to my undergrad in Bellingham, Washington at Western Washington University, where I majored in kinesiology and sports exercise. So it's always been in the background. Health, fitness has always been a really strong passion of mine. I then went on to Bastyr University for their naturopathic medicine school and really loved it there. I was thinking I was going to specialize in women's health and fertility. And I ended up graduating there, doing a residency in women's health, really loved it, but ended up deciding to step back, start my own business, which was called Voda Health. And I traveled around and gave vitamin injections. Although naturopathic medicine is very much about addressing kind of root cause, holistic view of health, the vitamin shots were this really beautiful kind of propel into the right direction when people start feeling better from an injection of B vitamins. So that business I ran for the last 6 years. And then the past year, I decided to join forces with Dr. Falcone, and we are now called Physician Coach. So I am here at Marlene's. I'm your local shot dealer here. And then Dr. Falcone, do you want to speak? Yep.
All right, so I'm Dr. Falcone. If I haven't met you, I've met you. So my initial introduction into sports medicine started when I was very small. I grew up playing soccer, played all the way through the collegiate level, had my own fair share of injuries, and kind of came out of that passionate about medicine, passionate about learning more about sports and recovery. From there, I decided to commission into the military. So I did all of my medical training with the military, started out doing the reserves, went to a osteopathic school or a DO school in California, then started my residency at Tripler, which is in Hawaii. So it's a pretty good residency. From there, I did 2 years as a tactical physician in Colorado. So started to get more and more training with injuries specific for soldiers. Then decided to do an extra fellowship in ultrasound to basically hone in my musculoskeletal skills. Did that here at Madigan. So that's what brought me to the Pacific Northwest. Then I did another 3 years with a tactical brigade here, where again, at that point, I was kind of higher up in the military, was allowed to run my own clinics and really started to do sports specific stuff. It was there that I actually kind of had the idea of what physician coach has turned into. So I got to work with the Special Forces unit, and they are far ahead of holistic medicine. So at their large facility gym, they had a ortho doc that would come in. They had a sports medicine doc, me, that they basically enlisted to come in, a PT, strength coaches, a dietitian, and even a mental resiliency coach. So they kind of already had that system working. I fell in love with it, loved working there. And that kind of bred the idea of physician coach. Met Dr. Hopkins, and the rest is history.
So, physician coach, we opened in August of 2023. So we're just about to celebrate our 1-year anniversary, although both Dr. Falcone and I have practiced many years before that. The idea of physician coach has been new for the last year. So we're located in Hilltop, Tacoma, which we absolutely love. Are you able to play the video? I took a little video of our neighborhood. So we're located right next to Ice Cream Social, a cafe, the Link light rail, the T line just opened up, and there's a stop right in front of our clinic. I want to give you a little glimpse of what our clinic looks like. Show it. Technical difficulties. Okay, so here's our main street. There's actually a new bakery coming in next door, which we're excited about. This is our clinic space. As you can see, the Link light rail comes right in front of us with a stop right in front. And then inside, it's both a medical clinic and a fitness gym. So it definitely doesn't look like your traditional doctor's office, but it's a big, beautiful space where we see patients and then also run our functional fitness gym out of. So we've really loved it. And we definitely have a disco ball. So, Dr. Falcone and I decided to join forces about a year ago, combine our passions and really just fill the gap that we saw was missing in the healthcare space. So we are that functional medicine clinic, and then we are also a functional medicine gym, functional fitness gym, excuse me. So two worlds that typically are divided, that a lot of people know of both, but we are trying to bridge that gap, which we think is the missing piece in kind of our healthcare system right now. So a new title, physician coach. It's why we named our business this. Because these two worlds are so important to lasting foundational longevity, we wanted to bridge that gap of being the knowledge of a physician, but then also knowing how to use the tools of implementing fitness programs, sports medicine, and getting people moving because of how profound its effects are to our general health. So the US spends a staggering amount of money on healthcare dollars, yet we consistently rank some of the highest rates of chronic disease in the United States. So something needs to change, and that's just where we kind of came up with the tagline, medicine reprogrammed. Programming is a term that's often used in the fitness space. It's where your coach or your instructor will create a program for you to follow in the gym, whether that's lifting weights, cardio, and we want to kind of reprogram, reshape medicine. And that's what we're doing at Physician Coach. So we do believe that the most profound thing that you can do for your health, longevity, wellness, disease prevention, health optimization, and disease reversal is to approach health with a functional medicine philosophy, but then also pair it with a exercise prescription. And like I said, there is this big chasm between the fitness world and the health world, and we're really just trying to bridge that gap. So I wanted to introduce two people who aren't here today that are a big force in our team. These are our coaches. So we have Chassie Seppi, who is the head coach at our our group fitness gym. She is CrossFit certified as well as a bunch of other certifications, and she is just absolutely fantastic, has worked in the rehab space, and we're super excited to have her on our team. She is often seeing patients after Dr. Falcone does some type of sports medicine treatment. They work together to kind of get that person moving well again and healing from whatever injury they may have. And then Wyatt is he is our operations officer. He's also a coach and head of the functional fitness portion of physician coach. And we're really excited to have him on board. So we are functional medicine, functional fitness, creating a functional you. So I want to take a brief moment to talk a little bit about the principles of naturopathic medicine. I am a naturopathic physician, and a lot of our philosophy at Physician Coach is based on some of these principles. Because Dr. Falcone practices a little bit more functional medicine, didn't go to a naturopathic medicine school, it's why we call it functional medicine. But these are the 6 principles of naturopathic medicine. And I find them very, very important for patients even to understand. So first, do no harm. That often means going with the lowest level intervention first, making sure that's checked off the list before we go to something higher that potentially has a higher side effect. We treat the whole person, and this is really just that holistic view. Oftentimes in healthcare, we have so many specializations. People get lost in the mix of seeing so many different providers. So this is really taking into account the whole person and everything they have going on with their health. Doctor as teacher is another one. We absolutely love educating our patients. And this is, leads to so much better result in the end when people really understand what's happening with them and understand why they're doing the things that they're doing and how important it is. And so we do love to teach. Identifying and treating the root cause. This is a huge tenet of naturopathic medicine. It's not putting on that Band-Aid where it's very easy to do in a lot of scenarios. It's easy, it's quick, it's what our medical system is kind of geared for. But we are really trying to find the underlying issue to what may be causing, whether it's an injury or some other health condition that you may be dealing with. Prevention is always something that we're talking about, whether we're treating something acute and then how do we prevent that from ever happening again. Whatever your health goals are in your life, whether that's at age 70, 80, 90, 100, how do we prevent, any type of disease onset from happening? And then harnessing the healing power of nature, which I think we all understand. There is a lot of powerful herbal medicine, natural medicine, lifestyle medicine that we can talk to people about, get them using in their daily life that really is profound on our health. And then one that I like to add is physician, heal thyself. And that's really just talking about, your doctor, your healthcare team, really putting into practice a lot of these things also. They know it, they experienced it themselves, and they're really excited to bring you through that journey. So we really value this one at Physician Coach. Our whole team is all on that journey with our patients also. The therapeutic order, this will be really brief, but I just, that very base of this pyramid is establishing the foundations of health. And that's where with naturopathic medicine, we are looking at a myriad of different things, whether that's your sleep, your stress, your diet, and making sure that those are solid before we are adding in any other treatments. One of these that goes at that very bottom is exercise, right? There's nothing more profound than movement and exercise that we can do. We want to make sure that that's there before we start adding in supplements or some other intervention. So the mitochondria, does anybody remember that it's called the powerhouse of the cell from middle school? It's was a great campaign. I feel like anytime you mention the mitochondria, every single person says the powerhouse of the cell. So chronic disease does not happen overnight. It is a process. It is a continuum. It doesn't just happen. And that's something that we're really struggling with in the United States on figuring out how to catch it early, how to prevent its progression, and how to reverse it. And that's something that we absolutely love doing. We do believe that this chronic disease epidemic, whether that's, Alzheimer's, metabolic disease, different cancerous process, it can start at the level of the mitochondria. So we do a lot of things at Physician Coach that look at the mitochondrial health and try to optimize the mitochondrial health that then has a beautiful systemic effect on healing or reversing disease. So, the most profound treatment for an unhealthy mitochondria, does anybody know? Or optimizing your mitochondria? Exercise. A lot of different forms of exercise. Muscle is a really big one. And then I put functional medicine, and I really say that just because there's so much diet, lifestyle, antioxidant support that really centers on targeting and treating the mitochondria. And then the last one, your mom. And I don't mean that as a crude joke. We actually inherit all of our mitochondria from our mother. It is maternal DNA. We do not get anything from our father. So although you can't go back and choose your mother, your mom gave you your mitochondria and gave you the foundation of which your mitochondrial health lies. So this picture is, there's quite a bit there, but we have a healthy mitochondria on one side. And then this is a rendering of a diseased mitochondria. We are able to reverse that. We're able to create new mitochondria. So just keeping that in mind in a lot of our treatment plans is really special for us. So have you or someone you love ever dealt with an injury or experienced any type of pain? And I say this a bit jokingly because it is ubiquitous. It is everywhere. We all have had some type of injury, some type of pain. And unfortunately, a lot of people either don't get it fixed, don't get it treated completely, and it becomes their new normal. And then they go on, they have different movement patterns that are awry, or they stop doing things they love. And to me, that is something that we really want to address because movement and doing things you love is so important to a healthy life. So developing a really strong musculoskeletal system, like I said, through exercise, building muscle is going to be really important in addressing injury, preventing injury, and making sure that your mitochondria are healthy to heal if you do have an injury. So muscle is medicine, movement is medicine, and mitochondria is kind of that key for us. So how do we get people to move and prioritize? We really just need to identify their goals, their passions. Although we absolutely love weightlifting, we are CrossFit fans, we have a lot of other movement activities that we love. We really want to know what you love to do, and we want to expose you to different things and find which one will be most sustainable for you. The next thing is we really need to address that pain that's inhibiting you. And that's where Dr. Falcone is so incredible in her treatments that she does with sports medicine, is it addresses that pain or that limiter that then allows people to open up so many other doors that they've maybe had closed over the years because of that either chronic pain or injury that never was addressed. So we pair that with the functional medicine approach. And exercise physiology, we'll talk a little bit about, is something that we do a lot at Physician Coach. So Dr. Falcone, you want to take over?
All right. So first thing I want to talk about is the conventional approach currently to injury. And I see this every day, a lot of people coming out of the insurance market because one of the biggest things is they can't get seen for months out for an injury that just happened. So when we talk about the traditional approach, and I very much grew up in this traditional approach as well as part of my training, but patient comes in for an injury and we typically have to send for imaging. Why do we have to send for imaging? Most often because an orthopedic surgeon will not see the patient without it, right? So if I have to send for injury or for imaging, I may have to wait 1 to 4 weeks to get that as the patient or the doctor. Once that imaging comes back, that determines the next step. Maybe a referral to physical therapy, maybe a referral to ortho. From what I'm hearing, it takes about a month to see either one, unless it's a cash-based PT. Okay, so now we're 2 months outside of injury, no treatment yet. Okay, once they go to the ortho doc might look at the MRI and say, hey, there's nothing to do here for me. This is non-surgical. So now what? Patient is left there waiting 2 months to go see a specialist who tells them, I can't treat you. That is what basically the epidemic I'm seeing every single day and what we're trying to fix. The biggest thing that is limiting healing, in my opinion, is delayed treatment. If I could get my hands on someone earlier, same day of treatment, within a week of injury, I can make so much more progress than when I see someone after a year of chronic pain, chronic changes in the body, and now I'm having to slowly peel back the layers of healing with my techniques. Okay, so what we're trying to do is create a more functional approach or a what I call a physician coach approach. Okay, so our goal is to basically cut out the middleman. We get to do the diagnostics done by the physician to make the diagnosis, who can do plenty of different treatments. And I typically know when I need to go to ortho or when I don't. And so what that does is allows us immediate treatment, immediate diagnostics, and usually back to activity much, much faster. Okay, so how do we do this? So I get a patient, whether it's onset of injury or chronic injury, it's the same thing for me. Okay, so I do a functional assessment, which includes kind of movement, palpation. I'm checking out and actually feeling what's going on with that patient's body tissue. Okay, I pair that with my diagnostic ultrasound. So I'm getting kind of an outside approach and then an inside approach of what the tissue is telling me. Because as we know, sometimes an MRI may show a herniated disc, but that is not the source of pain. All right, there is all types of source of pains out there, and they're not always what we see on imaging. Okay, the next thing I do is my regenerative injections or my sports medicine treatments, and I'll go into depth about what that is. And the other thing I do that I have found to be just as important as a steroid injection or a fancy PRP injection is actually treating the tissue around the injury. So after an injury, our body is very protective. It starts to do these compensatory mechanisms, and those need to be treated just as much as the injury site itself. Okay, and then lastly, a lot of the stuff that I have started to learn from Dr. Hopkins is once I've done the healing, I've done the tissue treatment, now how do we make it so that the person does not get injured more and that injured side is stronger than the uninjured side? And as well as that is actually taking a look under the hood of our blood. And so I may have all of these fancy tools to make someone heal, but if they have physiological limiters in their blood, that is actually limiting their ability to heal, then I can do all of these things all day and that patient will not heal, right? So there may be something that's even deeper seated that we have to treat that led to the injury in the beginning, okay? So we'll go into these pretty in depth. Okay, so first thing is that functional assessment. Palpation. I like to bring this up because I actually have had a couple of patients come to me and say that they saw a doctor, they went down the process, X-ray, MRI, nothing's wrong with their back. I said, what did your doctor think was wrong? I don't know, they never touched me. So I've actually had patients who have gone down the whole pathway and no one has touched their back. The craziest story I had was actually in the ER in the military, where I think it was a teenager, had gotten all of this imaging, and we put up her shirt, looked at her back, she has an abscess, which is a skin infection. Had nothing to do with an MRI, right? So if someone had just looked and touched, they would have had their diagnosis first aid. All right, the next thing I look for is weak or turned off muscles. So this is something that not a lot of people know about, but anytime that our body gets injured, it tries to protect itself. One of the ways it does this is it actually turns off muscles. So an ACL tear is a really common one where a person will tear their ACL and their quad muscle will start to atrophy pretty quickly. The body is doing that because the body does not want the person to use an unstable knee. Okay, and so the other thing we're looking for is which muscles are turned off and how do we turn them back on? Okay, and then compensatory patterns. So this is kind of what I was talking about. A really easy one that I see a lot of is the shoulder. I see somebody with a rotator cuff tear, let's say, it's been there for years and they start to have neck pain, they start to have back pain, they start to have numbness down their arm. All of that is their body has been guarding that rotator cuff for so long that all the muscles around it are now tight, irritated, overused, and all of those now are causing pain. So I can take out the shoulder pain, I can treat the rotator cuff tear, but now they have a whole secondary issue that needs to be treated. All right, and then getting into the diagnostic ultrasound. So what is really amazing about ultrasound now, and I am very, very grateful for the time that I got into this because it was right kind of at the beginning of ultrasound starting to rear its head as this thing that was going to basically change medicine. The emergency medicine department was the ones leading the way as far as making ultrasound portable and no longer just in the hands of an ultrasound tech. So this is actually my machine right here. You guys will get to see it later, but basically it looks like a laptop, but has the diagnostic power of an MRI. Okay, in the hands of a appropriately trained provider. Okay, So that has made it so, basically changed the way that I practice medicine. Okay, so what can we diagnose? I like to say basically everything, but I do have some limitations. So one of the biggest things I see probably is a tendinopathy, which is a chronic wear and tear of a tendon. The most common that people know is golfer's elbow, tennis elbow, plantar fasciitis. People come in a lot for that, and that's a layman's term that most people know. So anything tendon related, I can diagnose very well, and sometimes I can see it much sooner than an MRI. Next thing is joint swelling or cysts. This is also a super easy one that an ultrasound can pick up. Anything, it's actually what I'm seeing here in this video. Anything that is black on ultrasound is a big pocket of fluid. Okay, I can stick my needle right in there, pull out the fluid, treatment's done. Okay, muscle and tendon tears. This is also another great one where I can see potentially a tear that an MRI won't see because my ultrasound is dynamic. What that means is I've had a tricep tear before where when I first look, everything looks okay. The moment I make the patient contract, the tricep opens up, right? And I can see a tear that an MRI might not have seen. And on a more personal note, I had a tear on my thumb, a ligament tear that looked completely normal on MRI. They said I didn't need surgery. I said, hey, my thumb literally is popping out of socket. I think there's something wrong. When they did the ultrasound, they could see my joint open up completely. And they're like, okay, that's surgical, right? So having things that are diagnostic like that, where we can actually test them under imaging, it becomes invaluable. Okay, and then the last thing is nerve entrapments. This is another one where I just wish more people knew, because I can actually treat things like carpal tunnel syndrome without having to do surgery. I can relieve pressure on nerves in the wrist, in the elbow. I've had probably 3 or 4 piriformis releases now since working at Physician Coach. And that's just getting that word out that I have a non-surgical option for nerve pain. Okay, so what are my goals here with my treatments? The first one is to treat the pain. The reason that this becomes so important is a person cannot do rehab or strength training if they are in pain, right? Pain is a huge limiter for a lot of people. And so I get a lot of referrals from physical therapists that are basically, they can't do anything else because the patient is in so much pain that they can't do rehab. So this is where something like a steroid injection becomes very, very powerful, because if I can reduce pain to allow rehab, then we have treatment. All right. And so that is my primary goal, is how do I reduce pain so the person can get better? Okay. The second one is to heal injury without the need for surgery. That is my secondary goal. Can't always do this. We don't have anything magic yet, but PRP and a simple understanding of how the body heals goes a long way, to the point where there's some people where I can just needle their tendon, re-stimulate the healing process. Their body does the rest. They don't need surgery. They don't even need PRP. All they needed was a needle into a tendon, which sounds counterintuitive, but our body responds to healing if we give it the right stimulus and then give it the right rehab. All right, so what are my treatment options? Steroid. Again, so this one gives me a lot of pain relief for a lot of different patients. The reason that I think I have a lot of success over some other doctors is my ultrasound. I can see when there's inflamed tissue. I can see when there's an inflamed fat pad, which some people don't even realize fat pads become inflamed. I can see when there's a bursa that's irritated. Those things, if I can bring down the inflammation with an injection right into the source, pain is gone. They're immediately doing rehab same day. Okay. So that's how I use my steroid injections. I never use them as here's a steroid, now don't do rehab, right? We don't want to do that. Okay, next thing is joint aspirations. So imagine that you have a water balloon stuck in your knee. Of course, you're going to have some pain. And so sometimes our knees fill up with fluid, our shoulders fill up with fluid, and the simple relief or reduction of pain is to pull that fluid out so that that joint can now move normally. Okay, so that's another really, really big one that people just kind of say, well, my knee has some fluid on it, but it always does. Let's take it off and let's see what we can do with the pain and with the rehab. Okay, and then platelet-rich plasma, which is the fancy one that everybody loves. I see a lot of people that want to come get PRP. I end up talking them and myself a lot of times out of PRP and fixing them with a much simpler source. But the reason PRP works is we are taking the healing factors from our own blood and we are putting it into a source that does not have a good blood supply, i.e. tendons or ligaments. Those do not have a great blood supply. So sometimes if we take the healing factors themselves, put them directly into the site of injury, someone will have a faster recovery rate. Okay, so that's the point of PRP or stem cell, if you've heard of that. Okay, and the nerve hydrodissection was what I mentioned before, which is basically if a nerve is trapped, which nerves are typically when they get a carpal tunnel is a trapping of a nerve. I go in there with a large amount of fluid. I open up the space, remove the entrapment. That nerve is now free to move and can start to heal. Okay, the next thing that I go into is what we call body priming, which is basically treatment of the tissue that is surrounding the injury and releasing that. First one is myofascial decompression, or what people call cupping. This got pretty famous with Michael Phelps in the Olympics. He came out with a bunch of circles on his shoulders and everybody's like, what's that? So basically what we're doing is we're treating the fascial plane. So there's muscle that can be injured, there's bone that can be injured, there's ligament, there's tendon, and there's also a fascial plane, which is basically this layer that encompasses our entire body. To the point where I had a patient who came to me for back pain, and his pain was actually coming from his fascial restriction at his ankle, where he had had surgery years prior. Okay, so understanding the fascial planes and understanding that they may be a cause of restriction or pain is important because everybody before me had treated his back, and his back had never gotten better. Once we started to target that fascial plane down his hamstring and into his foot, he started to have some relief. Okay, red light therapy. So this is one that plays a little bit of a part on the mitochondria to allow for some healing. It's going in there and it's trying to heal or stimulate that healing process that we try to get out of pretty much everything that I do. Everything is trying to stimulate the healing process, whether it's passively with red light or it's more invasively with a dry needle. It's all the same process. How do we get the healing to come back to a site that your body gave up on? Okay, dry needling. This has become one of my favorite tools in that it heals a ton of people. This is me doing a more muscular dry needling. We'll do a demo of dry needling today on Dr. Hopkins to treat her injury. But this ends up providing a lot of relief if the patient can handle it. So sometimes this is a little too much for people. They're a little sensitive. I've had people actually bend my needle or shoot my needle out because their body is like, no, I will not take this.
And this has nothing to do with acupuncture.
No,
It's a totally different concept of the needles go into the tendon or.
yeah, I do use their needles because they're great, but it's not acupuncture.
You know, I will say there potentially is some overlap as far as, say if they were, you know, hitting fascial planes that are similarly, but as far as the philosophy of chi and accurate, you know, points of acupuncture, dry needling is not addressing those.
Okay, and then trigger point injections. So this is sometimes I'll get someone where their muscle is so tight that putting a needle in it is not enough. And I actually put a little bit of lidocaine in there and I say, hey, muscle, please relax, right? So I'm using my full force of not only a needle into the spot, but then some lidocaine and relaxing that. Really, I'm only using this for an acute spasm if someone's in a motor vehicle accident, had a bad tackle in football or rugby, and they just need that. That thing is so tight. It's going to take weeks for it to relax. This is a quick way to get it to relax. All right. So why do we need it? Like I've already said, we're trying to remove those compensatory patterns. Those things can end up causing pain and limitations in themselves. So the sooner that we get to an injury and treat it, hopefully those patterns don't show up. But if I'm seeing you chronically, then we're going to be having to peel back the layers of what your body has done to protect itself. All right. And then we're going to get into the functional rehabilitation and strength training. So this was something that I was lucky enough to learn when I got injured in college. At that point, my trainer knew that injury recovery was not just about rest, ice, compression, elevation. Everybody used to do that. Back when I was in college, we were already learning that strength, proprioception, plyometrics was so important to recovery and was what a lot of people are missing. So once the initial inflammation is gone, now it's time to jump on, okay, let's get the muscles working again. Let's get that sport-specific movement. Okay. So kind of talked ahead of my slide, but basically that's what I'm seeing is most people get to the injury, the treatment, they start some of the passive rehab, they forget that strengthening is a huge part, and then performance is a huge part. So this is one where I am really trying to force activation of a turned off muscle, so his glute is not working. And so that band there, I'm not only getting him stronger, but I'm trying to get him to move functionally better. Okay. And then we get into performance. So this is one that's like really common for ankle injuries. This is my daughter making a little show here, but time and time again, I would see people do their banded exercises, maybe do their single leg strength. And then I'd say, okay, well, what did you do next? Well, then I was told I was done. What about the jumping? What about the balance? What about all of those things that come with really stabilizing our ankle, right? And so people forget the next step, which is testing performance before they're released back to activity. All right. And then getting into our healing optimization. So this is where I started to dabble into the functional medicine, and I started to realize that there is a lot more to healing than just what I'm doing in my sports medicine world. Okay, so just to highlight some examples that I've seen, the cortisol to DHEA ratio, if you haven't heard about this, cortisol is catabolic, which means it tells us to break down. The DHEA is anabolic, and it tells us to build up. If that ratio is off, and I am trying to get someone to heal, but their body underlying is saying, no, I want to be catabolic, I want to break down, they're not going to heal, right? Their body is literally limiting them no matter what we do on the outside. Okay, another really common one is vitamin and nutrient deficiencies. So let's take vitamin D, a very common deficiency here in Washington. A vitamin D deficiency will actually limit the ability to heal skin. So we need to get that vitamin D up. Vitamin D levels of a normal range from, let's say, Lab4 is as low as 30, but really our optimal range is 50 to 90. So understanding that we need to be optimal to heal our muscle and to heal our skin, it becomes a huge factor in healing processes. The funny thing is I've seen now somebody come back from an ortho surgeon who actually put them on vitamin D for part of their healing process. So even they are starting to kind of understand that there are certain things that we can do to help to promote healing. Oxidative stress. So this is a huge one for the mitochondria. If our mitochondria is already affected with chronic disease, other type of stressors in our body, and then we get injured, we are going to be feeling so much slower. If you hear people sometimes they're out there and they say, well, I just take a long time to heal, or I'm just sore all the time. Those are not normal. Those are signs that there's something underneath that's wrong. We should not be sore all the time. We should have a normal healing process. And you should, if that's not happening, then we need to dive deeper and see what's going on. Okay, and dehydration and electrolytes. This is another one where when we are dehydrated or we are not taking in the electrolytes we need, again, we are just not optimally healing. Imagine you're trying to deliver these vitamin and nutrients to your body, but you have thick blood, right? Like syrup trying to move around, or you have shriveled up cells because you don't drink any water all day. All of those things, our blood is our transport of all of our nutrients. If our blood is not the way it should be, then we're going to be missing that window. Okay, and then into our supplement protocols. So this is where we try to help our body, okay, with supplements. There's a lot of things out there like vitamin D, like we already spoke, even omegas that help reduce inflammation, or mitochondrial support supplements that take away that oxidative stress so we can heal better. There's a nice analogy that I heard on a podcast that was basically like, our glass is always half full of inflammation. If we let it get almost all the way full and then we get injured, then we're tipping over the inflammation of the cup, right? So when you're an athlete or you're trying to perform or you're just someone trying to heal, my goal is to reduce all of that inflammation as much as I can, whether that's supplements, diet, exercise, to allow your body to then have a little bit more space to heal. Okay, so trying to think about it as that is everything else you can optimize will make you heal better. And that's a nice way to think about it. Okay. Deal?
Yes. So I'm gonna touch on some prevention and optimization tips that we'll go through. I'm gonna try to breeze through them and then we can ask any questions at the end because I would love to be able to get to the live demonstration because that means I get some treatment from Dr. Falcone, which I am always excited about. So once, Dr. Falcone heals or at least gets somebody going on the healing process of some type of chronic pain or injury, it's really important to set that foundational work to prevent it from getting worse, prevent it from happening again, and then optimizing and getting even better than you were before, which is, always a great goal to have. So we're gonna go through a couple of these things. So first one is diet. There are a million different diets out there. It can get very confusing on what's best. And almost all of these points, I'm going to say it's going to depend on the person. But what I like to start with is ensuring that people are eating enough protein throughout the day. So instead of removing something from the get-go or putting you on some specific or stringent diet, I like to just make sure that you aim for 20 to 30 grams per meal 3 times a day at minimum of protein. Sometimes that can go up if you're training or you're healing or there's something else going. Sometimes it can be towards the lower end, but that protein is going to be vital and one of my number one tips. Making sure you're eating balanced meals of fats, carbs, and protein is all really important. A lot of this goes back to balancing our blood sugar, which is important in the healing process. We don't want too many peaks of blood sugar and too many low valleys of blood sugar. This is where utilizing a CGM or a continuous glucose monitor is sometimes utilized at physician coach, and that just is taking a little bit deeper look at somebody's response to foods to help tailor what's best for them. That's the image right there. That's actually me wearing a CGM. It's been really helpful in identifying certain foods that I respond well to. When I'm not feeling well, it's when my blood sugars may be off. So it's just another great tool to use. And I'm sure y'all know fruits, veggies, nuts, beans, fermented foods are all incredible to add. And then limiting or removing processed foods. And really all of this is our digestive system is so connected to our overall health. Inflammation is something that we want to address, whether that's coming from a food intolerance, an imbalanced diet, microbiome imbalances. So diet is something we look at that's going to help healing of everything. Lifestyle. I absolutely love this one. It's kind of an eye roll one. Everybody knows to kind of create a beautiful environment for themselves, surround yourself with like-minded people. But I find this so important in continuing the healing process, having a supportive group around you. A lot of this goes to our nervous system and nourishing our nervous system in a really healthy and beautiful way that allows for healing. Because when we are stressed and we have too much cortisol, that is what Dr. Falcone said, a catabolic state. That is not a conducive environment for healing. Sleep, 7.5 hours a night at minimum. Who does that? More if you're healing, more if you're training, more if that's just something that you need. I love talking about sleep hygiene, which is just removing those blue lights at night, not eating or drinking too close to bedtime. You do want your body to go into the fasted state at night. And that's when it kind of clears out your brain, starts healing other tissues. But if you're focused on digesting your food, that's going to be an issue. One of my favorite supplemental protocols, that's, not melatonin, it's not an herbal medicine. It is a blend of adaptogens and other herbs and phosphatidylserine that is really incredible in bringing our cortisol levels down, and that ends up helping with sleep. And then another thing that we utilize is growth hormone peptides, which we can talk about at some point. Next is stress. This is like one of my favorite little memes here. They're really the only 2 times that I feel stress. So hormesis, I want to touch on this. This is our ability to adapt and to grow. And this is that concept of healing, getting better, putting a little bit of stress on our body, and then taking that stress and growing from it. And I think that when it comes to stress, we always think it's a very bad thing, but it's really not. It's just being aware of it, understanding how much of it is in your life, what you can control, what you can't. Looking at your blood work, Dr. Falcone mentioned that cortisol to DHEA ratio, which is really important and can be easily manipulated if need be. And then of course there's supplements, diet, lifestyle modifications if we need to address stress. Hydration, very important. You know, we kind of aim for half our body weight in ounces per day. That's going to go up if you're training, if you're drinking caffeine, if you're stressed out. Electrolytes are something that we're almost putting on everybody, every patient. And I think one thing to note is oftentimes we do too little sodium. Sodium is
Such an abnormal concept of someone who's overweight.
yes,
No salt, no
yes.
salt.
So salt kind of got a bad
My
rap.
grandson knows. Mima, go get me some element, hurry.
Oh, I love that. You know,
Salt.
yes, and it's the same thing where we demonized butter and we elevated margarine in this
Okay.
process. Yes, so we've been through it, but salt is something that's been around forever and is really important to the functioning of our cells. We utilize something called H-Drop in clinic, which is a little device that you wear while exercising, and it actually will tell you how much of your electrolytes you are losing, and then give you a little bit more of a specific readout on how to properly supplement. Exercise prescription, we've talked a lot about this. Really, the main goal here is increasing lean body mass. That is our number one bread and butter as far as building resilient tissue, promoting longevity, being resilient to disease. And that's what we'll focus on. Zone 2 has gotten a lot of publicity lately, which is really great. Goes into our mitochondrial health, which is another beautiful thing. Zone 2 is a personalized zone for everybody, which we look at multiple ways, but heart rate. So we employ a test at the clinic that gives you your personal zone 2, and then that becomes a part of your exercise prescription. There's metabolic assessments, breath analysis, which we'll talk about in a little bit. And then supplemental support. You know, once again, sometimes acutely you need some supplemental support, but you can throw all the supplements in the world, and if you don't have those baseline foundational pieces in place, one of those being exercise, the supplements are not as effective and they aren't going to bring you long term to, you know, resolution of whatever you're doing. And then this, you know, although I could give you a myriad of supplements that are great for injury and healing, it's really going to be based on you, your blood work, your, you know, what your injury is. So there's a lot that we utilize, but it's really not a one size fits all approach. And then I wanted to take a second and talk about vitamin and nutrient injections. This is something I've been doing for 7 years in a very high volume, and I am constantly just amazed at how many people are depleted in very vital foundational nutrients, B12 being the most well-known. Whether they're not absorbing it, whether they're on medications that prevent its absorption, whether they're, say, a vegan and not getting it in their diet, the injections bypass the digestive process, ensure absorption, and make people feel pretty dang good. Just as a side note, the amount of people that come back and tell me their nails are growing is just showing you how much it's maybe helping. Yes, energy, sleep, mood, it's great, but it's also helping in that process of healing, growing efficiently. So quick plug, I am at Marlene's and Tacoma and Federal Way. I've set up right back here if anybody is interested in vitamin shots. I've been doing that for 7 years. I absolutely love it. My times and dates are on here. I do things outside of B vitamins, but those are kind of the most popular. Okay, so I'm going to give it back to you.
All right, and so this is just a quick introduction into our metabolic health testing. So this is another avenue that is only growing as we're starting to understand how important the mitochondria is. A resting and an active metabolic test actually gives us insight into how the mitochondria work actively. There is no blood test that will tell us that. Interesting patient I had where blood tests looked normal, but then I put them on the exercise test and their body had absolutely no ability to utilize glucose. And this was an overweight, chronically overweight person. So imagine that they are trying to lose weight and their body, their mitochondria cannot use one of their energy sources, right? Something I would have never picked up on the blood. So the resting breath analysis is super easy. You lay down for 10 minutes with the mask on And what it tells me is how much energy you expend per day. Why is this important? Because I have yet to find a patient that is eating too much for their energy expenditure. Most people have gotten into a calorie deficit for so many years that their energy expenditure is kind of bottomed out. What does that do when you don't feed yourself the right amount? Your metabolic system slows down. You have to eat less calories or else you gain fat. You are not healing from injury, right? Because you're not giving yourself the resources you need. So now it's this process, just like healing, where I have to slowly take away all of this chronic injury. I have to slowly help someone ramp their metabolic system back up. Okay. So it tells us that. The other thing it tells us is metabolic flexibility. So again, at rest, we should be burning fat. When you have diseased mitochondria, you are actually burning glucose at rest. So your body is now not functioning well. And we can see that with just a 10-minute test and be able to say, okay, this is what we need to do for your exercise to help your body transition into burning fat at rest. Okay. The other thing is our graded exercise test, which is what our coach Wyatt is doing right here. And so what this allows me to do is to individualize your exercise prescription. We individualize all kinds of things out there. And then we say, hey, everybody, 150 minutes is all you need. Everybody in the whole world, that's all you need. How are we not individualizing exercise? Okay, so I just had a patient today where I broke out, we did her exercise test, and I say, okay, for you, 2 times a week, we're going to do our zone 2 to help our mitochondria. 1 day a week, we're going to do our high intensity intervals, and we're going to hit your VO2 max, make sure your cardiorespiratory system is getting some work. 2 other days of strength training to build some lean mass. Okay. And then 1 day of more tempo. So the middle. So really, we should have a spattering of testing our physiological system, but most people either are not working out enough, or they're only doing one form. They're only doing long, slow, steady state, or they're only doing CrossFit, right? We don't even do that. We understand that we have to kind of open our eyes to the fact that we need to hit all of our physiological systems to truly be healthy and live a long time. Okay. All right. And then our functional fitness classes. So we did not start Physician Coach with the intention of functional fitness classes. What has happened is I had a group of patients basically that I've seen from the beginning who went from not being able to move, stopping playing their sports, not being able to walk their dog anymore because they were in so much pain, months and months of continuing to see me, putting in the work, getting healthier, to the point where they were like, hey, I'm good again. Now what do I do? They wanted a community to work out with. So they asked months in a row, they kept asking me. So finally we're like, okay, you know what? I think there's a need. And I think some of our clients would really benefit from finding this community together in a safe space where there's a physician that's writing the programming, working with the coaches to make sure people aren't getting hurt, and also slowly sneaking in mitochondrial exercise. So these people are getting healthy and they don't even know it. All right, so we started our functional fitness classes and we're pretty excited about that. Oh, and then one additional thing, I slide in some mitochondrial support and I also slide in some rehab. So pretty much all day, these people are doing shoulder stuff, hip stuff. That is all rooted in what I'm seeing in my injury side. So I'm saying, hey, everybody's hurting their shoulders. We're going to do some shoulder rehab for the next month of classes, right? So being able to understand where injuries are happening and trying to prevent them with the programming we're giving our clients. All right, any questions?
I did have a question about the. What does that mean? I mean, how does that manifest? Does it metabolically speak to your mother directing your now?
Yeah, so yes, in a way. So mitochondria are separate from a lot of our, or different from a lot of our cells, in that all of our other cells can, have a combination of the DNA that we get from our father and our mother. Mitochondria are these really interesting, if you look at the evolution of them, have been around forever. They kind of are what made us human, but they only contain maternal DNA, meaning it's really only coming from your mother. As lifestyle is so important to a lot of our health. genetics are important to a lot of our health, but lifestyle influences that and can change that. So it's not necessarily that you're destined to have the exact health of your mother, but your mother just gives you the basis, the starting place of what your mitochondria will be.
I wish I had my mother, but it wasn't happening.
Yeah. Yeah, and so that's where, there's a part of me that really hates the saying, but it's genetics loads the gun, lifestyle pulls the trigger, right? So it's, yes, genetics are there, but what is it that we can manipulate your lifestyle that doesn't make you just, destined to be whatever you were born with? So yeah.
That's a good thing.
Yeah.
To know.
Yeah, I don't think we have any questions.
Okay.
But, I'm gonna say goodbye, to everyone on the video.
There's somebody up there.
That's shirts too.
Oh, yes, that was me.
Yeah. Yeah, we do have shirts if anybody wants to support the mission. We brought some of those today, but then.
And they're also available on your website too.
Yeah, I bring them every once in a while. Somebody says, "Oh, why did I bring them when I give shots?" So it's always available too. Okay.
Thank you everyone for watching. We're gonna end the video. We're gonna do a in-store demo.
Yay!
I B12 and I was low, so I had taken for, like 4 months at least,
Yeah.
6, the tablet.